Welcome. My name is Heather Van Brunt, and I am the Help Program Manager at MnAdopt, and I'm here today to give an overview on our Help Program services. Welcome. So I will start off just giving some background and overview. Our Help Program is an initiative that was created in 2011 by the MnAdopt organization, and we started back in 1980 as an organization, but the Help Program itself started in 2011. And since 2011, the Help Program has provided accessible, reliable, and knowledgeable support and guidance to the Minnesota adoption, foster, and kinship community. And we have the ongoing support from the Minnesota Department of Human Services. We are a private nonprofit agency that is in collaboration with them for this Help Program. Our services are free and they're available to any Minnesota family who adopted a child under state or tribal guardianship, internationally or through private adoption, and through kinship adoption or guardianship, or who is providing foster care for children in our state. We talk to individuals who have moved out of state, though our services are focused on Minnesota residents. Our program also assists community professionals, and that can range from adoption and foster care workers at private agencies, county workers and case managers, community professionals at schools, in the medical community, lawyers. These are all examples. Also adopted persons, adopted adults, and birth and first parents and family members give us a call for resources and support at times as well. Examples of support in those categories with professionals in particular can be objective and confidential case consultation, referrals to different community services, therapeutic referrals for clients that have specialties in adoption, attachment, and trauma. Also giving information on all the educational opportunities that we have at MnAdopt for both professionals and families. We also give staff presentations on adoption issues and Help Program services, and just continue to be here for as an ongoing and accessible support in our community. At the Help Program, we have a team of help specialists. Our staff, we staff a statewide warm line and provide phone and email-based support. Our specialists have a variety of backgrounds. They're all seasoned professionals with advanced training in adoption issues and varied professional experiences, and are very well versed in the unique considerations for adoption, foster, and kinship families. Our staff are available by phone and email during regular business hours to provide objective and individualized support and connection to the resources needed. We are a warm line, not a crisis line, so it is available Monday through Friday during business hours. It's not a 24-hour crisis line. We certainly help folks get connected to those services when needed. During the pandemic, we have a little extra flexibility to meet with families at different time frames because everybody's schedule looks so different these days. That's something that we are able to, on an individualized basis, look at times if our regular hours are outside of what a family's ability is at that time. So give us a call and we can figure that out. So our services include support, guidance, and connection to resources that are as tailored as we can to the specific needs that a family brings to the table. So we engage with callers and those who interact with our program to learn as much as we can about their presenting concerns and the dynamics they have going on at the present time. And then we highlight resources and supports that are tailored to that caller's needs. This might include educational offerings that we have at MinAdopt, support groups around the state, community organizations, and therapeutic services if that is a need for the family. A very powerful part of our role can be to help fill gaps between services and systems, assisting with who to connect to, how to advocate for services, and what services or organizations that aren't necessarily labeled as adoption support or post-adoption support, but might fit for a particular family at a particular juncture. I wanted to highlight that sometimes some of the things that people are navigating are children's mental health case management. They might be navigating specialized school support. These are areas where we can just help have conversations and help folks get ready for different kinds of conversations and know how to, who to connect to, what to navigate around those, in those realms. Some organizations that we sometimes are, some examples of organizations when I was saying that aren't necessarily labeled as adoption support, but could be really helpful for people at different junctures, are places like PACER for school support, the ARC for advocacy and services for those who have mental health and developmental disabilities, Family Voices, an organization that helps around parent support with kids who have special needs, and NAMI, Minnesota chapter of the Organization on National Organization on Mental Illness. They've got a lot of parent support and advocacy as well. And Proof Alliance, which is an organization that supports parents and families and kids where fetal alcohol exposure has been part of the mix. Those are all places that we can help have good conversations with families about when and how and who to connect to at those organizations as well. Some services, some other, I want to give a little plug here for our MinAdopt educational offerings. A big part of what we do is helping people connect to, what's available through MinAdopt, through the many educational offerings that we have. And that has really grown over time. And we are able to help be a bridge to getting people connected to webinars, and when we're back to having in-person events, being able to have people connect to that. And also I'll be talking a little bit later about the services, the funding assistance that we have to make that a little easier for folks. I have a quote on here from a family who attended and been able to get some funding assistance through our help program to attend the Beyond Consequences training at MinAdopt, and how powerful that was for them. They state the trainings and support I've received through the Beyond Consequences training has helped me more than anything else to navigate the complex influences that have affected my children and make some sense of it all. I've changed how I parent as my understanding has grown, and I love my kids in a whole new way, and we've changed our behavior and our interactions and our outlook in life-giving ways. What a blessing for all of us. So that's an example of how our help program and education program work hand in hand to make these kinds of life-changing experiences with education that they get to be accessible to folks. One thing I want to back up that I didn't say from a couple slides ago is, our services, when folks have interaction with us, can look a lot of different ways through, emailing us or through a phone conversation. And so just want to point out that I'll back up here a couple of slides. With this warm line that we have for our help program, we are, we're not making families have a particular kind of interaction with us to get the help that they need. If they email us and have a very specific question, we certainly just email, an answer to that, welcome them to have like some more dialogue through email or a phone intake, but we get them what they need in a quick fashion, and then leave the door open for more interaction to happen through phone or email, or for them, right then, or for them to feel welcome to connect another time down the road, as we're an ongoing resource for folks. So sometimes it's just answering an email, but oftentimes it's a phone conversation, and that phone conversation can be anywhere from 10 to 15 minutes with a family, or as much as 45 minutes to an hour or so, depending on how deep a family wants to or needs to go with talking through the situation at hand. Parents and caregivers have a lot of control over, they have the control over what they share and how they share with our help specialists. We help guide the conversation, but certainly they are in control of what gets, how deeply that they want to share on any given thing that's happening with their family. Another point that I wanted to make around that is just, our interactions with folks are confidential, and unless they give specific release of information to speak to somebody on their behalf, in coordinating services, something like that. When we do speak with those providing foster care for kids and teens, we do have to make a statement in the beginning of they can't share identifying information about a child in their care. They could share some themes that are coming up for them as a family, and we can get the parent focused support in there, and work with the parents in that situation, but we can't have them share identifying information about the kids. Certainly we can collaborate with a county worker in a situation like that if there is a request or need for coordinating and putting heads together on services that would be really helpful for a child in foster care. So wanted to mention that. We'll move on. All right. So a big thing to highlight with our programming is that we have relationships with therapists across the state of Minnesota who have strong competencies with adoption issues across the lifespan, who are trauma informed and competent, or attachment informed and competent, are using modalities that are in line with what families need in those areas. So we are tasked with building a network of therapists who have those competencies, and we do that across the state. These therapists that are connected to our network have gone through a vetting process with our program and demonstrated their deep understanding and expertise in these areas of working with adoptive, foster, and kinship families. So we're able to help families connect to these therapists for ongoing therapeutic services. We try to help match and highlight, who might be really particularly helpful based on everything from what they've shared in their interaction with us, that are some background issues at play, as well as, who takes their insurance, who's most accessible to them. We don't have an in with, being able to control therapist schedules. So, sometimes there's still puzzle pieces to be, put together to find the right match and availability with folks. But we help in that process of getting people connected to that ongoing therapeutic service that's going to be most helpful. Medical assistance is for those who've adopted from foster care will follow their children to cover most things for what they need medically and, you know, medical services, mental health services that medical assistance will cover. Though something I'll talk about in a bit here is how our services and some of the funding assistance that we have can be helpful for parent-focused or individual parent or couples-focused therapeutic support that would be out of private insurance for the family. Talk a little bit about that in a minute. So we're helping folks get connected to ongoing therapeutic support that fits. We can also help families who may be in crisis connect to one of several therapist consultants that we collaborate with across the state who have really strong capabilities in all the areas that I've mentioned and have availability and keep some availability in their schedule to be accessible to our program for families who have who need more at a particular juncture and in a faster way. So consultant services can be for one or more parent-focused consultation sessions as things like crisis services, case management, or ongoing therapy services are being coordinated. They can really fit a need and a gap in those situations to help stabilize the family by boosting really critical parent-focused support that's going to benefit the whole family. So that is something that our program is often helping parents connect to when the need is there. So another big unique thing about our program where we are fitting a unique need within this adoption and foster and kinship community of families is that we have funding that is there to support families in a few key areas when there's some financial barriers present. This is pretty, it's always worth, a call or an email to explore this further. There's no set way that this looks. It's not that we have unlimited funding in these areas. There is, limits to it, but we can explore in creative ways and in case-by-case ways for each individual family of where some of this funding might be really helpful. So we have financial assistance that we can potentially tap for out-of-pocket costs with our vetted therapists. Families have to make sure to contact the help program ahead of time, to do that first, to explore the funding assistance for a particular therapist that's vetted and connected to our network, so that we're all on the same page about what that allotment is going to go for and what sessions and what amount, all of that. We have to have that figured out ahead of time. We aren't able to retroactively pay for services, but from the point a family contacts us, we can explore a plan for services moving forward. So we are, I mentioned before that an area where this might be most helpful is even if a family adopted has a child in their care that has medical assistance that is following them for a lot of this insurance needs. Some of the very powerful stuff that can be layered in with all of this is to provide some extra support for individual and couple and family therapy that might have to go under the private insurance that the parents or caregivers have. And so many of us these days have higher out-of-pocket costs with copays or deductibles or both that can be enough of a barrier for people to take the step to get their own support. And so I'm really proud to be and thankful to be a part of a program that can help bridge some of that and make these services more accessible. So it's a big part of what we're able to concretely help people with getting the right match of adoption competent and trauma competent and attachment competent services. The funding assistance that we have also can be available for the educational programming that we have at MinAdopt. So we help with a fair amount of scholarships for families for one or more of the many offerings that we have through our education department at MinAdopt. And so whether it's a small amount or a little bit more for like a series that we have, like the Beyond Consequences series that I mentioned or highlighted earlier, it doesn't matter. We can help in a smaller way or something for something that's just has a little bit more cost to it for some of the series that we offer that are still pretty low cost, but we're all about bringing down barriers and making things more accessible to folks. So that's another exciting area that we can help with our funding and our help program. Another area that is a part of our contract with the Department of Human Services right now that we've got some funding for is for family needs, certain needs that families might have during this pandemic that we're in, this extended time that we're looking at of just family life looking different. So when there's been loss of income due to the pandemic, we're able to maybe help with some things that are more base needs, like a gas or grocery card. We might be able to help with some other categories under this are like occupational therapy or sensory equipment that would help with emotional, physical regulation for a child in the home who's maybe not able to access the same level of in-person services, or just with the extra stress during these times, could use some of those, that kind of equipment in the home. We're able to help. We could explore some funding for that, or just some things under family fun and connection, during these times that we're in. We can meet with families individually on different possibilities that might help in those categories. Even with some of the distance learning challenges that folks are having, there might be items that we could be of assistance with to help that go a little bit more smoothly for families as well. All right, we've got just a few more slides here, just sharing some professional feedback here. I think what the help program does is a model program, and one of the best I've been involved in. That was from one of our help connected therapists, another agency social worker, sharing that their adoptive families are appreciative of the services from the help program, and they find us quick to respond with options and ideas which help the adoptive parents we work with locate services, education, and supports. Another couple of examples here of parent and caregiver feedback. It's a very good resource for parents who don't know where to turn. I had no idea what to do with my kids. It was a very bad time and I needed direction. The help program helped me find a therapist and helped talk me through what was going on. Any parent who might be in the same spot would appreciate their help. Another one says, your support helped me turn a pivotal corner today in seeking support for our precious daughter and family. I don't feel alone anymore. I'm so thankful you picked up the phone and spent time listening to me while being highly responsive. A rare combination. Thank you. And we're so thankful that folks are finding this service that we have helpful. We are passionate about what we do at the help program, and find what we do very rewarding to help families have hope, get to a new spot with services and support, and just get all that they need through the different junctures and chapters of time that they go through with their families as time goes by. These are the ways to contact our program. We have a mainline number there to our warm line. There's also the help-program@minadopt.org email that comes to a central spot where we divvy that out daily and which member of our team is going to get that. And we look forward to you connecting with our program. We're ready to listen and ready to help in any way that we can. Thanks.